Hey there. It is so good to have you with me today. Thanks for being there. I want to show you how I do an iris assessment in under 20 minutes. And actually, it'll probably be much less than that. Well, it would be less than that, but I'm going to be explaining how I'm thinking as well. So that's going to probably take the full 20 minutes. Normally, an iris analysis doesn't need to take that long. Just by quick way of introduction, my name is Judith Cobb, and I am a level 3 IPA certified instructor. We have to keep our credentials up to date, which means that when we do, we are issued new badges, which is why it looks like I've only been in the iridology world since 2020, according to these badges. And so I've actually been an iridologist for over 4 decades. I've studied lots of different styles of iridology, and I've been an iridology teacher for nearly 4 decades, constitutional teacher for about 3 decades. So teacher and also iridologist. So just there you go. I'm one of 8 level 3 certified iridology instructors in the world so far. I'm also a master herbalist and a natural nutrition clinical practitioner affiliated with these lovely organizations that you see on the screen. Let's dive right in. Now, you're going to find you'll get more out of me if you play with me in the chat box. I love questions and I love comments in the chat box. It tells me that you're not falling asleep and that the information is important to you. Just to lay the foundation, I typically start with my clients seeing them once a month for about 4 months. And then I like to reduce them down to an every 2 to 3 month schedule. And then eventually we get it down to twice a year. The goal here is not to have them coming to see me every month for the rest of my life or their life. The goal is to have enough time to teach them what they need to do to get their health in order and to get control of their health. Now, what typically happens is, in reality, is I'll see them not, 3 or 4 or 5 times, and they're feeling really good, and then they disappear. And so when I invite them to come in for a 6-month check-in, they often don't. And that's okay, because I know that in 3 or 4 years, when they start to fall apart again, when they start to have problems, they're going to come back. And we're going to do 3 or 4 or 5 appointments at 1-month intervals, get them back on track, and then they're going to disappear again. And that is the real ebb and flow. It's not my optimal ebb and flow of things, but it's how it generally works. This is a fellow that I had seen in 2017 for the first time. And in 2022, he started coming back. He's now 64 years old. He is 5 feet 11 inches tall, and he is 175 pounds, but he would really like to be 165. He is employed as a security guard, which involves 1 week out walking the perimeter of the industrial field or the industrial yard that he is helping with security on. And then 1 week of being in on the computers watching the closed cell or the closed circuit TV feeds. And so, he's got 1 week where he's kind of active out there walking around, and then a week where he's stuck in a chair. He sleeps well, he has low stress, and his work is not shift work. It's strictly daytime time. So that's great. He started coming back to see me because his doctor had determined that he is pre-diabetic. His hemoglobin A1C, really important for you to be familiar with basic lab tests and to have a good lab manual on your desk. His hemoglobin A1C was 7.2. It needs to be under 6.4. Anything over 6.4 suggests type 2 diabetes. His glomerular filtration rate was 61, and the cutoff is 60. So he's coming really close, as in we want it well over 60. When his glomerular, that's a word I have trouble saying. When it falls 60 or below, we know the kidneys are in trouble, and that is usually an indication of heart problems. So he's at a 61. That's not a good place to be. In the 3 months prior to coming back to see me, he had cut out soda, he'd cut back on his snacks, and he was walking daily for exercise. So that is really good. He's been taking on his own 7,000 milligrams of omega-3, 1,000 milligrams of vitamin C, 5,000 IUs of vitamin A, and 400 IUs of vitamin D. So he doesn't have a great balance with his supplements, but at least he's started. I can work with that. This is what we really need to pay attention to, is what were his primary concerns. In order to do a valid iris assessment in a very condensed amount of time, you need to focus on what your client's primary concerns are. We don't want to be looking at every single little detail we see in the eyes, because many of those details are not relevant to the here and the now. So his primary concerns: his cholesterol was elevated, his blood pressure was elevated, his blood sugars were elevated, and that is the framework that we're going to work with his eyes and make recommendations inside of. Now, while he was with me, I also noted frequent throat clearing, and he reported having a dry cough in the morning. Now, I want to know, what do you know that frequent throat clearing, that kind of thing, what is that sometimes an indication of? Yeah, Chana's hitting it right on. How's his digestion, heartburn, low stomach acid? Well done, Chana. Woo! Excessive mucus. And so, Jack, we're going to trace that back. Excessive mucus from what? Again, possibly from reflux. That irritates the esophagus. That creates excess mucus. And that gives you that constant throat clearing. So right on. Well done, people. So I want you to notice that his left eye, so this, we're looking at his eyes as if he is sitting across the table. So his nose is right here. This is his right eye. This is his left eye. Notice that his left eye is droopy. That is very common with older people. And we often need to get them to literally prop their eye open when we are doing their photos. And I did have him do that. I didn't put that photo up because I wanted just images with frontal lighting here. Sometimes with an older person, I literally have to get them to hold the top lid up, shoot one picture, pull the bottom lid down, shoot the other picture, and then kind of put those together in order to actually get a complete frontal iris photo. So let's do a brief description of his eyes using iridology terms. Now, just before I do this, I want to know, a show of hands, how many of you are at least a little bit familiar with constitutional iridology language? Chana says yes. I know Jack is. She's a graduate of the course, and Veronica's in it right now. So anybody else? Yes. Okay, so we've got, most of you are quite new to this, so I'll give a little bit more description. Amy says, yeah, kinda. Thanks for that. Basic terms, I'm studying with Bonnie and Farina Sharon. Okay, thanks, Lauren. Appreciate that. Okay, so these eyes are lymphatic eyes, which means they are blue eyes. And we know that blue-eyed people are more prone to elevated acid in their system, which usually manifests as excess mucus or inflammation. He has a neurogenic structure, which means he likes things to be peaceful and calm. He is over acid. His eyes suggest that genetically he wants to be over acid and slightly uric acid. What do you know acid does in the body? So we're talking systemic, not digestive. If someone has systemic acid, what does that cause in the body? I want to see some answers here. He has an atonic collarette, which means his intestinal tract is probably a little bit too relaxed. And good work, Chana and Jack. And, I missed the name there, Amy. It's inflammation for the acid. Good job. And so he's also slightly hydrogenoid, which means that his lymphatic system is going to be a little bit prone to being sluggish. And we know that he has a slight lipemic diathesis, which tells us liver enzymes have likely been out of balance for some time. Now, this is not an iris sign. This is a corneal sign. So it's not genetic necessarily, has a genetic influence, but it's not hardcore genetic. And because of the liver enzyme issues, he likely doesn't handle his carbs properly, which means that could be messing with carbs going into cholesterol, or carbs in such a way that it's going to mess with the pancreas and how he balances his blood sugars. He has a stomach ring, and he's got an inner gray border, both of which suggest that we have an insufficient digestion at the stomach level, which means proteins are likely not being digested properly. We probably don't have the release of the hydrochloric acid in the stomach to actually do the proteins. He has a very tiny slight brown pigment right here. Now, This is really important. You look at that and you go, what is she looking at? And it's just this little teeny tiny fleck of brown. When we've got eyes like this that have very little for pigment and other markings, less is more. So when we see this, we want to pay attention to it. So this is telling us liver wants to have an issue. And that's interesting because that is sitting roughly in, it's a little low for liver. It's probably more in the bladder zone. It could be the edge of the pancreas zone. That's kind of an area where things are pretty tightly close together. So that's interesting. We want to pay attention to that. With all of these concerns, he had blood pressure, cholesterol, blood sugars. He'd already been to the doctor. He was on several different medications. He had tried Glumatza for the blood sugars, but that gave him diarrhea. So the doctor switched him over to Jardiance. You need to have a good medical drug reference book on your desk because your clients are going to come in using medications. You need to take that moment, look at the medications and understand what the meta is for, and then look up in that book. It should list contraindications with other medications or with other herbs or with other foods, other vitamins, things like that. And you need to really be paying attention to those details when you make your recommendations. So he's also on hydrochlorothiazide, which is a diuretic for blood pressure. So something with the kidneys, right, if he's on a diuretic, but that keeps his blood pressure under 125/82. He's on Trandolapril, which is an angiotensin converting enzyme inhibitor. That's for the blood pressure. He's on sildenafil, which you'll know as Viagra. Well, he's on these blood pressure meds. As soon as they go on blood pressure meds, it ruins their ability to have an erection. And now he needs Viagra to help with that. He's on myelin atorvastatin, which is an HMG-CoA reductase inhibitor, which is fancy kind of a statin drug. And he wants to get off the meds. But he's on this whole smorgasbord of meds, and I am not licensed to take him off those meds. So we have to work around this. Shanna is asking, could that little pigment mean MTHFR? It's absolutely yeah. Same eyes, different lighting. Why did I do that? With frontal lighting, it actually masks some of the details we want to see. When we go to side lighting, can you see now that we have wrinkles in the eyeballs? Can you see the wrinkles? If you can see the wrinkles, I want to see wrinkles in the chat box. Give me wrinkles in the chat box. Yeah. Jack, you're rocking this. That is anxiety tetanic, right? That is someone who internalizes their stress, burns through their B vitamins and vitamin C and calcium and magnesium very quickly. Now that's important because we need magnesium and B vitamins to regulate that blood pressure. Let's look at a sclerae because the irides are genetically determined. It's what your parents gave you. Cornea has some input from you. Sclera is everything you're doing to yourself. How many times are you shooting yourself in the foot, right? And so as we look at the sclera, this is its left eye. And I only know that because I marked it as such in my teaching notes. You can't tell it's a left eye from sclera photos. So you need to mark your photos really well, label them well. So we've got a meander, which suggests circulatory congestion. We've got a bordered meander, which says significant circulatory congestion with a risk of stroke. We've got beginnings of what could be a fermentation. And another one here. I want to watch this to see, but I'm going to treat it as if it's a fermentation mark, which would say again that he's not managing his carbs well. And the carbs are going into sugars that are fermenting. That is something that I often see with type 2 diabetics. A lot of people that aren't T2D will have a yeast infection, right? And T2D and yeast are like this, right? And so we've got a slight yellowing of the sclera in many areas. So that makes me wonder about liver, right? We've got lots of other signs. We've got this spiral here that Jack has caught, which is all about blood pressure. We've got lots of other indicators in the sclera, but they're not relevant to blood sugar, blood pressure, cholesterol. We're only focusing on what is important to the concerns the client brought in. Then we go to his right eye. Again, we've got lots of bits of meanders. Some of them are pretty tangled up. We've got, again, lots of sort of slight yellowing in the sclera, which makes us wonder about liver, right? It's jaundice. If there's a pinguecula, yeah, that usually suggests that the liver is not managing things, and it's usually a fat protein buildup, if you will, on the eye. We've got, again, meander down here. We've got a meander here. We've got a meander here. We've got a meander here. We've got, this isn't quite a bordered meander because this is not wavy enough. If this blood vessel here goes wavy, it will be bordered, and that will change what we are, how we are working with this. So you'll also notice he's got this big patch of blue-gray. That, and he's got a little bit of it down here as well. The blue-gray is an indication that he's not oxygenating his tissues very well. Well, that could go with elevated blood pressure if his arteries are clogging, and elevated cholesterol, right? It's all there. Really common to see that kind of blue-gray clouding in the sclera in older clients. Again, we're only looking for things that connect with what he wants help with. All right, so that's what we're focusing on. Those are the marks. So let's go back to where we started and start putting those marks together with his symptoms and help us understand what's going on here. You ready for that? Now, for those of you who have some kind of iridology background, I just want to find out how fast was that iris analysis? That was the analysis. That was looking at the markings we need to look at. Was that faster than how you were taught to do an iris analysis? If that's faster, I want to see faster in the chat box, because we're not splitting hairs. What will happen is, after several appointments, when we've got really good progress, I will then say to my client, would you like to work preventively? And then we will look at the eyes. I'll get much more of a family history, and I will then start digging deeper, and we'll put together some preventive work. He has stomach ring, gray border, comb teeth, and lipemic diathesis. Those are things we need to pay attention to. I asked him about his diet. He typically had a steeped black tea with a cinnamon bun or a muffin. So Amy is asking, so the eyes will change that fast? The irides will not change. The sclera will take 6 to 12 months, but the irides will not change. Jack is asking, how quickly does he eat? Well, that's a good question. I'm just thinking, you know, this tea and cinnamon bun or muffin, not great for cholesterol, right? Not great for blood sugars either. His morning snack is usually fruit, grapes, apple, banana, orange, or Cheerios or a Fiber One bar. Okay, none of those. Well, the Cheerios and Fiber One are not great. At lunch, he has a sandwich, which is on white bread, and it'll have processed sandwich meat or tuna or maybe egg salad. So the egg salad maybe isn't so bad. Supper is typically pizza or meat and potatoes or meat and pasta. He just kind of eats whatever is easy and quick and something that if there's leftovers, it'll be good for lunch tomorrow, right? How much water does he drink? Not much. So in these eyes, because there are not a lot of markings again, what we need to remember is that little things that are in the framework of what we are looking for are really important. Okay, so we know his diet's not great. We know his digestion is probably not great. So I asked him, do you tend to be farty or burpy? And both was his answer. So that tells me he's not digesting well. So when we're talking about fartiness, the question is there an odor? Yes. Is the odor like, yeah, so I passed gas. Oh, well. Or is it, oh my goodness, I can't believe I just did that. Because the second one says protein is a problem, right? That he's not digesting protein. China says more protein to keep him full and a digestive enzyme to help him break it down and help assimilate, eye watering and room clearing. Yes, absolutely. So that was the description of the protein gas. I did recommend that he change his breakfast from carbs to protein and veggies. I get a lot of my clients to do a little meditation, and it goes like this. Protein and veggies, protein and veggies. right? Because that's what we need for balancing the blood sugars. And we don't want potatoes in those vegetables. We want the lower carb veg. I suggested that his snack should be an apple with some peanut butter, or some good, and I mean good quality peanut butter, not the cheap loaded with icing sugar and loaded with lard peanut butter. I mean the real fresh ground peanut butter, or some good quality almond butter. Lunch, we had to kind of get adventuresome. How about a nice big salad with some protein on the side? It could be leftover steak or chicken from the night before. Dress that leafy salad up with some tomatoes or some cucumbers, some celery, some, whatever, some broccoli, some whatever you want to do here. And if you even want to have a bit of a salad dressing, that would be fine. I have no objections as long as it's a good quality salad dressing, right? So we wanted more protein and lots of low carb vegetables, and we want good fats. We don't want him avoiding fats. So could you put some avocado on your salad? That would be a good thing. Could you, do a homemade olive oil and balsamic vinaigrette for your salad? That would be a good thing. And I suggested that he walk 30 minutes a day. Now, I went a little heavier on the food on the first appointment with him than I normally would, because remember, he'd been in to see me several times 5 or 6 years ago, and he'd forgotten everything. So this first appointment was really about reminding him of what we probably talked about 5 years ago and getting him back on track. For his supplements, we use some L-arginine. What do you know about L-arginine? Blood vessels, yeah. It helps to create the nitric oxide, which vasodilates, which can help to reduce blood pressure, right? We also suggested doing some berberine IR for the insulin resistance. So we're working his diet to balance his blood sugars. We're getting him walking to help him burn off excess blood sugars and make him more insulin receptive. And we're using supplements to make him more insulin receptive. If we can get those sugars into the cells to burn them for energy, we're going to have less sugar to go into cholesterol, and we're going to have less sugar to go into being insulin resistant, right? To making those cell walls brittle. His second appointment, now, I use the same set of photos for the whole first year, because the iris is not going to change quickly at all. And I'm speaking primarily of cornea, or watching for pigment accumulation. And the sclera is going to take some time too. So there's no sense in wasting the time taking photos when we're not going to see anything useful. So in his second appointment, we used the same photos, and we did a little bit of work. He had some labs done, which was really great. And the labs showed, these were labs his doctor requested, because I can't request labs, but my clients bring me their lab tests because doctors don't talk about them. And so doctor flagged him for having low potassium, which is a side effect of the diuretic he's on. So we needed to build his potassium, and bananas are not a good source of potassium, just saying. His hemoglobin A1C, this is amazing. What was it when we started? It was 7 something, down to 5.9. Anything below 6.4 is good. So he was down to 5.9, and his triglycerides were down. That was just not after very long of starting on the program. We added, in the second appointment, we added protein digestive aid, which is hydrochloric acid. We helped him stabilize his blood sugars, right, with the walking, with the food choices, with using the berberine IR. We added a herbal potassium blend. We needed to get that potassium back up into the right range, because if sodium and potassium are not well balanced, the kidneys struggle. And so again, we kept the berberine and the L-arginine. With this, and being on the blood pressure med, his BP, his blood pressure, was averaging 118/71. In his third appointment, we suggested adding resistance exercise daily. Now, this was actually easy to do. Remember, he's got 1 week Every other week, he is in the office in a chair watching these closed circuit TV screens. And he does need to be attentive. That is his job. But he could easily get stretchy bands and sit in that chair and do things, or stand and watch the computers and do things. So we got him doing some stretchy band resistance, and we kept him walking 20 to 30 minutes a day. So good, so good. At the 6-month mark, he sent me an email, and he was clearly doing the happy dance because his blood sugars were so in control that the doctor stopped the Giardians. That is so cool, right? So cool. And the doctor said, if you keep up getting these kinds of results for the next 6 months, we'll be taking away your blood pressure meds and your cholesterol meds as well. So we're just coming up just a couple more months till he's hitting that 6-month crest, and he'll get his labs redone, and then we'll see what needs to happen. I'm just so excited with his progress. And so many of those things, I wouldn't have known to pinpoint if I didn't do the iridology, right? The iridology showed us where to work and how to work. So we just keep tweaking his program a little bit every time we meet, adding a supplement, taking a supplement away, increasing a supplement, reducing a supplement, reminding him of his food homework, reminding him of his physical activity homework, giving him more ideas of things that he could do to augment what he's already being successful with. He is so loving this, and he's so excited with the prospect of possibly getting off all of his medications. So exciting, because once he's dropped the blood pressure meds, he'll be able to drop the Viagra as well, right? Because his blood pressure will be naturally regulated the way it should, and it'll all be good. So this is so exciting. That was actually about 4 appointments worth of work condensed into 30 minutes. Now, having said that, my first appointments with clients are an hour and a quarter long. Why would I want an hour and a quarter when I can do an iris assessment in 10 minutes? Shanna says, because you listen. That's exactly it. It's because clients want someone to talk to. They want to be able to give their story. They want to feel heard. And that's the beauty of iridology, when he says what his problems are, and I can then relate iris markings to his problems, he knows I've heard him. So important. Something they don't get from the medical world. Julie says, and yes, you need the whole story, especially when you can't be with them 24/7. Yeah, you do. You need to hear the story. It's not uncommon for them to say, oh, I've been rambling. You didn't need to hear that. And I say, you know what I did? It helps me to know who you are, and it helps me to know how I should work with you the most effectively. So yes, whatever you feel impressed to tell me, I'm here to listen to it. All right. I even jot down little notes while they're talking, ask relevant questions as we go. Right. And so it's so important that we not condense this and scrunch it down just because we can. Would you like to be able to do an iris assessment that quickly and to create programs that quickly? Do you think that would be great? Totally. Yeah. I'm just going to spend like 2 minutes on this. I'm not going to spend a lot of time on this, just an invitation. The next live start date for the Dynamic Iridology Assessment System program is starting on January 25th. And I only accept 10 students per course. You do need to have a college level anatomy and physiology course under your belt already. Now that could be, maybe you're a registered nurse or a registered massage therapist or a physical therapist or an ND. Maybe you had to do a separate anatomy and physiology course of something like, 60 or 70 hours as a part of nutrition training or of your herbal training. And so this is really, really important that you have that, because the depth you saw me go into as quickly as I did is only possible when we understand how the body works. Okay, so really important for us to have that foundation. If any of you are thinking, "Ooh, I'd love to take iridology," but you don't have A&P, please reach out to me so that I can connect you with a good anatomy and physiology course. I don't teach it. I don't even get commission for sending people to it. It's just a course that I think is really excellent. And get that under your belt and then come back to me and we'll talk about the course. If you have A&P and you're interested in talking with me about the course, then there's this link, iridology.education/course-info. That is how you get in touch with me to schedule a Zoom call. That's how you schedule a Zoom meeting so that we can talk about what training you've already got, where you want it to go, what your goals are, and we can discuss whether this course is a good fit for you. It's not a good fit for everybody, and I recognize that, which is why we have to have a conversation. You have now seen how easy it is to do an iris assessment in just a few minutes and to nail it and do a good job, to not overwhelm your clients, to create programs that your clients can easily stick to. So important. They only get the results they earn the right to have. And you can help them get those results if you build their programs in logical sequences that they can actually take action on and put into place. I really look forward to speaking with you soon. Take good care and bye for now.